Hello everyone, my name is Dr. Subodh and this is my YouTube channel Learn from Psychiatrist. Now today we are going to talk about a very important topic, that is depression. Now depression is one of the most commonly searched terms over the internet nowadays, and I think most of the people will agree with me that at some point of their life they have struggled with depression. But what does it actually mean? Did they actually struggle with depression or was it just a temporary feeling? So this is something we are going to talk today in our topic in this video. Now, what is depression? Now, depression is one of the most commonly seen mental health problem or disorder in our clinical practice, in which a patient may feel sad or low in his mood most of the time without any apparent reason, and this mood state is non-reactive to his circumstances. Now, when I say sadness, it's a normal feeling. At some point of time, everyone is going to feel sad, but behind their sadness, they have some reason. For example, if today I'm going to suffer a loss, probably or obviously I'm going to feel sad about it, but behind my sadness, I have got a reason. But in case of depression, there is no apparent reason. And they're gonna feel depressed or low in their mood most of the time throughout their day. Also, this is non-reactive to their circumstances. For example, if they are having something to cheer up or if they are having a good news, probably they're not going to feel happy about it. Or even if they are feeling happy, the level of enjoyment or level of pleasure will be reduced than before. Now, one more important thing. How lengthy could be depression, or what is the duration of depression? Now, to qualify as an episode of depression, the minimum duration should be 2 weeks, but an episode of depression could last from 2 weeks to 2 years. On an average, we can say the depressive episode can last 3 to 9 months, but again, symptoms and duration, they can vary from person to person. What causes depression? Now, I must tell you that there has been a significant amount of research in depression, but so far it is difficult to pinpoint what exactly causes depression. But what we know so far is that there is a chemical in our brain called serotonin. This chemical is important in mediating symptoms of depression, and in people who struggle with depression, this chemical serotonin is in low concentration, and that's why we give them antidepressant, which actually boosts the level of serotonin in the brain. Now, sometimes depression can run in family. That means there can be some genetic component behind it. Sometimes there is no reason. It's idiopathic. Coming to the prevalence, how commonly depression is seen. I think it is very frequent and it's one of the commonest clinical syndrome we see in our clinical practice. What I can tell you that roughly 1 to 2% of people, they have struggled with depression at some point of their life. But if we take account of secondary depression, which is usually reaction to their life event, I think 3 to 5% have struggled depression in their life. What are the symptoms of depression, or how to identify that a person is having depression? Now, it can be easily understood in the context of lowness or sadness of mood. So first thing is that person is going to feel sad or low in their mood. Second, it is going to affect their level of interest in daily routine. They're going to lose interest in their hobby. Third, it's going to affect the level of motivation. They will not be motivated to do their routine work. They're going to feel tired, and they can describe it as lack of energy. So people can tell that I'm tired throughout the day. It can also affect the appetite and the sleep. People usually they report a lack of appetite and they can actually lose some weight. People also tell that they are having difficulty sleeping. Actually, what happens, people who are having depression, they do not get sufficient amount of sleep. They tend to wake up early in the morning. This is something which is known as early morning awakening. Now, the level of sadness can vary during the day. Sometimes people feel more sad in morning, and as the day goes, they feel a little bit better. This is something we call it diurnal variation in the mood. This is usually seen in depression. Other symptoms could be problem with cognition like poor memory, poor concentration, poor attention, there can be some depressive cognition or depressed thoughts like feeling hopeless, feeling worthless, or they don't see their future brightly. They're going to have dark thoughts. And one of the most important dark thought is to end their life. People sometimes they can feel suicidal. And I must tell you, people who actually struggle with endogenous depression, they have very high rate of depression. 10 to 14% who people who struggle with depression, they actually end up doing a suicide. If we talk about male and female, depression is more common in female. That suggests some biological reason behind that, but we can talk about it later in the video. Risk. Now, risk is very important. I must tell you, depression can lead to various risks to a person who is involved. First, they can self-neglect. They're not going to take care of themselves. They will not be eating properly. They will not be sleeping properly. Probably they're going to struggle with their self-hygiene. Also, if they are not interested in doing anything, probably they are unlikely to engage with treatment. And like I told you, they might have suicidal ideation, and people who are actually having strong suicidal ideation, having a poor network, or having some other risk factor, they are very likely to commit suicide. And as I told you before, 10 to 14% of people will end up committing a complete suicide in depression. So that's why depression is very important to understand and is very difficult to manage. Differential diagnosis. I think the most important differential diagnosis is secondary depression, which is usually a result of depression due to our outer circumstances. For example, like I told you in my previous video, that mood or our mind or mental health can be affected by various factors, like due to our physical health issues, due to substance we are taking, or probably with our personal and social circumstances. So this is secondary depression, which should be differentiated properly, because the mode of treatment or management plan will differ significantly. Coming to the management, how can we manage depression in our clinical practice? I think the most important part is early recognition of clinical syndrome. So we must know what are the symptoms of depression, how frequent is it seen in our clinical practice, and what are the risks involved. So the first part would be to do some clinical investigation. Now, there is no investigation which can actually confirm the person is having investigation, but it makes sure that we are screening their physical health to check or to make sure that there is no other reason behind their depression. Also, it will help us to know what is the level of their physical health, because we have to start some medication if required. Now, psychotherapy. Psychotherapy or talking therapy is one of the most commonly utilized treatment for depression. And believe me, if depression is mild to moderate in severity, it should be the first line of treatment, and it can work miracles. If a person is not managed by psychotherapy or is having moderate to severe depression, I think the next line of management is giving medication, which are antidepressant. Now, I told you earlier that serotonin is involved in mediation of symptoms of depression. So antidepressant, they can actually lift the mood. They can alleviate the symptoms of depression. If a person is having a serious risk to himself, if he's not eating properly, or there's a risk to his physical health, if he cannot tolerate medication, ECT or electroconvulsive therapy is one of the options. Last but not least, support. Support is very important. The symptoms may vary from time to time, and there are times when people are really struggling and feeling suicidal, and at that time they need our support most. So providing with the crisis helpline, when they are in crisis, they can actually call and get some help is very important. So I think I have covered some important things about depression. Now, there's a lot of information to take on board. But what I'll suggest you, if you are having any further query, just do comment on my videos and I'll be more than happy to answer your queries. If you like my video, if you have learned something, I'll advise you to subscribe my YouTube channel so you can follow me and get regular updates. So I'm gonna see you in the next video with some other important topic. Till then, take care. Bye-bye.